Welcome to yet another exciting episode at Global Clinical Exchange Initiative on our YouTube channel. I am Dr. Hashir, and I will be co-hosting this session today with my colleague, Dr. Farrukh Siddiqui. Today, we are going to discuss a very important topic, and that is about the career path medical and dental students can take once they are done with their graduation. Usually, what happens is that both these students and their colleagues and their parents, guardians, friends think that the only thing a medical or dental student can do after their graduation is that they can pursue a clinical path. However, now with the vastness of healthcare industry, there are so many things to explore, so many career paths to explore, and not only do these paths offer good incentives in terms of monetary compensation, but they also help an individual in developing themselves professionally. And one such career path is of epidemiology and biostatistics. And to discuss further on this path and what its implications are, we have a very esteemed guest with us today. His name is Dr. Zohaib. He is an alumnus of Karachi Medical and Dental College. Although he completed his bachelor's in clinical dentistry, he decided to pursue his master's in epidemiology and biostatistics from Aga Khan University in Karachi, and now he is working for a private firm that researches on different clinical products for the pharmaceutical industry. So we will welcome Dr. Zohaib on stage now, and we'll continue this discussion further with him. Dr. Zohaib, welcome on stage, and thank you so much for joining us today.
Thank you, Hashir. Thank you for having me. Very excited to be here. Thank you for a very kind introduction as well.
Yeah, sure. So, as we have discussed earlier, that why we are going to conduct this session in the first place. I just wanted to, let our audience know that there is so much more to medicine and dentistry other than pursuing practice, and that's why we invited you today here with us. Beginning with my first question, that why and when in your career that you decided that no, clinical dentistry is not meant for me and I just want to do something else? What was the rationale behind that decision?
It's a very interesting question, and I've been asked this question I don't know how many times. Because more so with dentistry and dental careers, it's expected that they will continue with dentistry. So as a dental graduate, when I was finishing my house job, and like with every graduate, regardless of medicine or dentistry or commerce or different fields, I mean, the big question comes up: what's next? So at that time, I created a logical framework for on my notepad. I still remember it quite some time ago, and I had separate columns for each of the possible next post-graduation, let's say, qualification. One of them was FCPS, not the normal route, FCPS, any MCPS, the master's like academic route, the MDS, and many others. So one of them was MSc Epidemiology and Biostatistics from Aga Khan University. I listed down all the pros and cons. I met some of the previous alumni who were serving as part of their masters or let's say FCPS qualification, working in their own industry or profession. And I listed down all the pros and cons basically. And basically, I took the path that was most aligned with my own persona, that was most aligned with my intentions, what I needed to do with my time as a personality. I think those were the major reasons. I can go into more detail. One of those reasons was family. One of those reasons was marriage. One of those reasons was how I divide my own personal time. One of those reasons were how I find interest in doing things. And of course, one of them was monetary incentive. So I can go into further details, but I'll let you go ask more
Yes,
questions.
so
So
the next question
yeah.
I have for Dr. Zohaib is what did you struggle with and what factors, personal or professional, ended up weighing most heavily for you in your decision? As I have the question right on the banner as well.
Yeah. Thank you, Farrukh. So, I mean, yeah, we just discussed, I mentioned this personal and professional factors. So, personal factors would be, as I mentioned, what aligns best with my time and interest. So, when we were doing dentistry, I was very slightly on a very minor scale exposed to some aspects of clinical research. We were doing it as part of community dentistry, and that kind of sparked a bit of interest that what happens, what basically research is, what goes behind it, it did not seem like a very lucrative or very a career that will benefit me monetarily, but at least something that was still having some of the interest. Um, the reason why I weighed towards masters was basically it was from a more accredited institute. It had a definitive duration of start and end. It had some career prospect that was net helping me network with many esteemed professionals, not only clinically but also with research. For example, um, the Alpha University from where I did my masters, it provided a good broad platform to connect and broaden my work and horizon, not to work only in dentistry but also in any clinical field, as basically to work in clinical research. So weighing down those options, I mean, I went towards clinical research. I mean, I did had some peer pressure, some pressure from colleagues, some pressure from our senior faculty who were asking basically this question: if you wanted to go towards epidemiology or biostatistics or numbers, why did you even go to the clinical research? I mean, clinical dentistry in the first place. You should have gone towards Karachi University, did a master's in biostatistics. But I think the cross combination worked really well for me. I mean, what we see in the future is basically one background is not going to help or will be less sufficient if you have knowledge of two background or two dimensions that cross, and you can talk across both specialities, let's say. So a person with a computer science background who also has understanding of healthcare would be able to understand or put things into more perspective, or vice versa. I mean,
This combination of epidemiology and clinical dentistry did work out for you, but why epidemiology?
once I decided that yeah, it's clinical research for me, then there was a question of which program, which domain, which institute, things like those. So there's a health services academy Islamabad. They're doing really nice work. There's Afan University, we know, there's Dow, and there are many other private medical colleges as well that offer um, programs, master's programs of MPH and similar. I think that the choice of doing my master's in epidemiology specifically that combines biostatistics as a major component, it was because it provides very rigorous program. It provides very hands-on approach. It provides very well networked choice of faculties basically that you can approach and work with basically. So I think that was my primary reason to go towards master's program, to go towards epidemiology and towards Alphan University, because the degree of Alphan University itself had epidemiology and biostatistics component both. And as I said, it provided a good networking
All right. So,
opportunity.
like every profession, there are some challenges. So, what has your professional journey has been like as an epidemiologist?
My, if you mentioned professional journey as an epidemiologist, my inclination was towards more quantitative clinical research rather than towards public health. So there are further dimensions to it. The reason is basically I like numbers, I like data. So, and when I say data, data can be collected through many ways. You go out in the field and collect data. There are clinical systems in the hospitals and registries that collect data for you, basically. So that has been my research journey. I was previously part of Alhan University. I joined for a basic, very entry level research coordinator, and I joined the Bahar Institute, work as a research consultant, and I then came back to Alhan University again to work as a
Okay.
senior research instructor.
What does your current role demand from you? What are you working at? Can you walk us through it?
Yeah, basically. So when I was working with Alhan University, I was working in that was cross between clinical research and clinical trials as well. And one of those trials, one of those mentors was basically based in University of York, through which I got connected to University of York as well, because it was their grant, their program. They were working on tobacco research across Pakistan, India, Bangladesh. That's how I got connected to University of York, and from there, working in University of York, I was working in clinical trials with some aspect of real world evidence, um, like at collecting data from secondary, collecting secondary data basically. And now in Adelphi, when I'm working, it's more like very well aligned with my epidemiology background. It demands extensive attention to detail. It demands extensive management of clinical research, right from when you start writing a protocol to the end when you publish it. Basically, there are many dimensions of it. You have to be very on point about what's going to be next in terms of not only project management but also in terms of clinical research. Like you talk to a lot of people internally and with clients as well. It involves a lot of extensive planning. It involves a lot of reading, basically, and writing, if to break it down. But I like it.
And does it test your management skills as well? Because as clinicians or as medical students, we are not taught that much of management skills, like how you have to manage people, how you have to talk to them, communication skills. We are not really trained on that. So please tell us how your management skills have been tested so far.
I mean, they've been tested very rigorously, Hashir. We have never been taught these. I mean, no one gets taught these. It's like part
Hmm.
of the system when you work and grow. Even when you're a doctor, you have to manage some sort of clinic or your own system or schedule. So it starts right from there. Even when you have a student, you have to manage your time, basically, your household activities, basically. So I think it starts right from there. Yes, we have to manage our own team. We have to manage expectations, project timelines, deadline. We have to sit down and work across what would happen if a clinical research is posed differently, what would happen if a clinical population cutoff is changed, for example, in terms of age group, what happens in a specific gender, if we were to go there. So yes, it's very varied. The work I do across different global clients is, some of them is respiratory therapy area, some of them is hepatology therapy area, some of them is infectious disease, fungal infections. So it's very varied. It's very active, I would say.
Okay, right, right. So Farooq, next question is yours.
Brown myth, society myth, like, if you do BDS or MBBS, you have to pursue a clinical, in a clinical. If you are not having patient interaction, then they actually say, okay, why you are having this degree, or why did you pursue in the first place? So, coming back to your journey, like what bold decisions you have taken in your journey, would you actually encourage other medical students or dental students to look out for non-practicing or non-clinical fields actually, or should it be just a subjective decision like yours?
Mine was not very subjective. Mine was very objective. I took very informed decision to decide between which role to go towards. Um, I cannot comment on how people should go, but the choice of taking on practicing or non-practicing careers, it depends on your circumstances as well and your interest, basically. So we have to look broadly. What market are we talking about? What interest are we talking about? When I say market, I'm differentiating between global markets, let's say Europe, US. Let's combine them and say as West. Those are the centers of evidence generation so far. They produce evidence, they produce research, they derive research, basically. All the pharmaceutical
Yes.
companies and the world centers of academia, they are based there. So they would obviously like somebody who has multiple dimensional, multiple domain knowledge, who comes with more experience. Whereas the developing countries, on the other side, they are more like area for application, where more where there are less chances or less pockets of doing active research and more like application of those evidence, basically, which is kind of unfortunate. And that leads down to personal decisions as well. For example, if an MBBS doctor who has to run, or if a BDS doctor or if a physiotherapist has to run his family as well, and also has to go towards data science, he or she may have to first think about, okay, this is a job that provides me, let's say, 25,000 for a start, or if I put this on hold and go towards a training in data science. So it becomes a question of practicality versus your ambition. So if you have that cushion, basically, if you have that privilege that you can decide
Hmm.
or to go towards or try out a different field. For example, I do not see many discussions around medical legal fields. I do not see many discussions around healthcare administration, although we have people who are in healthcare administration, have a background in clinicals, but still a person who has this understanding of how a clinician who has understanding of how treatment pathways work in actual hospital, and then he go towards administration or does a degree in administration and go towards, I think he's going to be a wonderful administrator who knows how much time the patient takes, what's the treatment pathway basically, what's the language, how we can improve that system. So that's what I'm saying. So we should always make a logical framework, basically, what's working for me. Have Are you making an informed decision? Have you talked to people basically, who align with your vision, who understand basically, who can inform you? And then once you make a decision, it's fine.
So if a medical student is actually confused right now, that
Yeah,
so you were actually suggesting that he should look out for mentors who are actually in the field, who can guide them better, or they should actually look around other options, and they should have actually know their own background, that if they can take that decision, and they must be privileged for that as well, right?
of course. So and to add on that, I would say we have a culture of and a pressure as well to produce results very quickly, to provide to the family or to build up established very quickly. I think I think it's fine to take a break and continue doing what you are supposed to do. For example, if a clinician, anybody from any background, does not reaches a decision, I think it's fine, completely fine, to continue doing what you are supposed to do. For example, do clinical practice while you figure out. It's okay to pass FCPS Part One, let's say, after 3 years. It's
Yeah,
okay to
it's
take
okay.
time, basically. It's okay to take time and go towards clinical practice without doing any specialization and just doing a clinic. It's completely fine. There's different circumstances for anybody. But the point I'm trying to make here is, I think it's time to think about taking a step back and think cautiously what works best for you, because we are thinking about the long term. There are not many chances to do post graduation um, uh, qualifications or academia research or any degree at that many times. You only do these things once, twice, or thrice. So I would say, yeah, take time. It's fine.
All right, so that actually very. I think it will help a lot of medical students to gauge their interest and to take decisions, which actually it takes courage to one to make a decision. But I think discussing with mentors and looking at the people who are actually in the field will help it a lot. Thank you.
So,
Uh,
Dr. Zohaib, so till far we have got an overview of epidemiology, right, from you. So, do you know of any other fields, non-clinical fields that medical and dental students can pursue, and it matches with their ambitions? It somehow matches with what they have learned in their postgraduate, pre-graduate careers, in their graduation careers, and still they can find those fields lucrative, financially compatible, and help them in their professional growth as well. Are there any other fields aside epidemiology?
I again, I wouldn't. So let me begin with an example first, to make my case. In one of the seminars, when I was attending my master's at Adelphi University, I came across a profile of a person who gave us basically a seminar or described their work, basically what they do. They were MD, means they were an MBBS, had a clinical background. They did their masters in computer science, and then they did their PhD in electrical engineering. They were not local of Pakistan; they were from US, basically US national. To put things into perspective, and then they went onwards to set up a lab that develops instruments for endoscopic instruments, the complete system basically. Now think of a person who has a background in clinical knowledge, who knows a bit of computer science and does electrical engineering. I think there is no other combination that could have worked best for a person or for this industry, let's say, who has understanding of every different dimension that can go towards work developing an endoscopy instrument. So think of it like this: outside of developing countries, I think what I've seen is a very good platform or encouragement. Not a good platform, I would say it's an open world. I've seen people who had background in dance, they have done bachelors in dance, and they have gone towards clinical research. I'm just trying to put things into perspective. I've seen LinkedIn profiles of people who had background in electrical, bachelors in electrical basically. They pivoted towards public health. What's
It is
basically
it is a very unusual combination because it is like an unheard of that someone from an engineering background goes into the medical background or someone from medical background goes into
engineering?
engineering background because
Yeah,
when we see these fields they are like polar opposites, right?
absolutely.
In one
I,
field you are dealing with living human bodies and another field you are living with inanimate objects, but it's just amazing that how these two fields can be combined together.
of course. I mean, there's no short of examples where people from medical background now have gone towards software engineering. They've gone towards coding, let's say, for example. Of course, they would understand and develop those applications and interface systems better than people who had sole background from coding, let's say. The coding experience might be better for the person who's coming from coding background, but the overall domain knowledge that comes from the person who has health background is going to be way superior. So
Sort of.
that's what I'm basically saying. So now coming back to your question, what other healthcare fields? I would say there are many, but it depends what your market is. So a person in Pakistan who has a background of MBBS, PDS, physio, or other clinical backgrounds, I would say, if they were to go towards data science, there are specific boot camps, there are specific coding competitions. Basically, they go all the year round. You can catch up with NED, you can catch up with other universities that organize those, basically. But the point is, how do you turn this into an income stream? So you would have to find a company basically that requires your expertise, and that may not exist in that much abundant in Pakistan. That's how it comes round a full circle. Even if you were to go into these industries, so you have to find, and those industries basically exist more outside of developing countries and less in inside in the less in the developing countries, basically. So that's how I would say see the full picture. If you are able to pursue higher education, if you were to able to go outside Pakistan, I would say there are abundance of opportunities if you were to go towards medical legal system, healthcare administration, um, as I say, towards data science. I think it's very open. Within Pakistan, you would have to again think about how I can balance my interest with the earning potential as well. If you were to stay in Pakistan,
I think it's very important that we should change the culture we have right now, because one of my friends, I remember, right after her MBBS, she took a job at Al Khan University as a research associate, and she delayed her house job, and everyone was, very surprised, and they were like, why are you doing this? Why you're not doing house job? Because she wants to pursue masters in neurosciences, and that's what she actually wanted to be an academic, and everyone was confused about her decision. So I think we should change the perspective. So, but coming back to the topic, I think this is one of the most important question, that because everyone thinks that an epidemiology is all about being researching, analyzing, and sitting on the desk, and it's more of a desk work. So I think I have two questions for you, Dr. Zohaib. The one is, what is the most exciting part of your field, and what is the most mundane part of your field, like according to you?
thanks, Farrukh. Yeah, thank you for the prologue. I mean, and to be very clear now, I think it's important to describe epidemiology as well. So epidemiology, if you are a field epidemiologist, you will be in the field most of the times. So it has, what I'm trying to say here is epidemiology itself has many pathways. You can even go and become a data analyst. And if you are completely aligned towards test research, there's also different areas, different pathways. So my current title is associate manager. That does not obviously describe what I do in that well. So we see clinical research right from the start when clinical protocols are written, and it's not a field job. It's a desk-based job, but I would say it's a desk-based because we are relying on data that's already there, the secondary data that's collected as part of your healthcare system, that's collected as part of your interaction with your GPs, interaction with your health system, like primary care, secondary care. The most exciting thing about my field is it's very live. Um, it's very on hands. It's very, I mean, it's very difficult to think about the most boring part so far because every day there are new challenges. What I basically find very exciting is when a new research or a new proposal comes in from, let's say, a client or a company that wants our services. We have to basically write a very detailed protocol. And the amount of thoughts and interaction and basically personal thought process that goes into developing that protocol, that gives so much, I would say, experience and exposure, but also satisfaction that the level and quality of work we are doing, that's very, very nice in that terms, basically. We any The other exciting part comes up when we have our data come in based on the research protocol we develop, basically, and that informs if a drug is going to be effective in one or the other population. If the population characteristics are different, what we wanted to observe about, if a treatment has had any adverse effect as compared to the other one. So I think those are the times, basically, when other exciting parts come in my field. What's considered to be the most mundane? The question I see on the screen. I don't think there's any boring or mundane part so far, but maybe we'll catch up in a few years and maybe I can describe that question then.
What is something in that field you feel is much repetitive? Oh, it's again, it's going to be like that.
I think every aspect of what I do has to be repetitive for every other project. But that's the beauty of it. Every task or every milestone or every deliverable we design, it has a very predefined criteria. I mean, in terms of being repetitive. But when you apply this to other project, it varies so much differently. I'm talking about timelines. I'm talking about very simple admin tasks like taking minutes. Taking minutes of the meeting. Let's say it's a very mundane task, but it becomes useful when you go back and you have to see decisions, basically what was talked about in the meeting. Because obviously our brain cannot hold that much information. So somebody in our team has to have be in the meeting and is taking the meeting minutes, for example, become very important. So in that aspect, I mean, we have very specific, staggered, structured approach towards all the projects we do, and all those steps are repetitive. It has to be, but every project varies, so all those parts are kind of new every time in that sense.
Now that you
All
have
right.
mentioned that
Yes, yes. Asha, go on.
that we will look at the mundane part of your field in some upcoming years, and that you have mentioned this, I will like to uh, present my last question, or the last question of the session. That what are the biggest challenges that you think your field will be facing in the upcoming years? Is AI going to replace this field as a whole, or wouldn't there be any need of epidemiologists in the future, which I think is not possible because we see epidemics and endemics coming again and again. So, is there any big specific challenge that you would like to talk about? That yes, it is going to affect your field a lot, or it's just going to be working like it is working right now?
I, I wouldn't say the biggest challenge, but one of the challenges we face is how to keep abreast of ongoing changes in the regulatory approvals or requirements, basically. So every country has their own regulatory committee, regulatory governance, and they rely on evidence that's generated from many of ours, like pharmaceutical industry or clinical researchers, basically, and they require that. So obviously, the biggest challenge is how do we provide the best form of evidence with the minimum amount of time spent and the minimum amount of resources. So that's where I would say the derive basically is to produce a very sustainable model of research that continues and basically minimizes the um, time it requires from evidence generation to application of that evidence generation, because every drug approval at different stages at different phases will require a separate sort of evidence. So that's a very big broad picture. That's a whole different session we can do about it. You mentioned about AI. No, I do not see AI replacing our field. I think the only people that will I think the only thing that will be replaced are going to be the people who do not use or rely on that AI, because as every other tool, AI is a tool. It's developing really quickly. It has a huge computing power and relevance in our field as well. It can minimize times of analysis, produces graph like we have seen in GPT-4. What's it's capable of, basically.
Thank you so much, Dr. Zohaib. It was very nice to have you, and it was very informative. I hope a lot of medical students can benefit from the session. Thank you so much.
Thank you so much,
And
Dr. Zay, for your time.
thank you both for having me. Have a nice week.
Thank you. Have a nice day. Bye bye.